Okay, ladies and gentlemen, we are now diving into water and forests. And our first speaker here is Berit Arheimer at the Swedish Meteorological and Hydrological Institute. So, of course, water is at the core of our planet, at the core of life. How are we affecting water balance under climate change? Berit.
Thank you. So SMHI is the Swedish Met Office, but I'm at the hydrological side, so I'm going to speak about water. And of course, water is part of the climate system, and we have already heard a lot about water. But so I actually redid some of my presentation after yesterday, because setting the scene also included a lot of my previous slides. So, but water and health. We have a lot of medical doctors here. I'm not a medical doctor, but some of the problems that have been discussed is this with disasters, of course. Floods and droughts, this causes a lot of death, immediate death. But then we have also mentioned this with mental health problems, and I think this goes along also with the water. We also heard about this with the ocean. What did we call it?
Ocean feeling.
Ocean feeling, exactly. And I think people have this a lot when it comes to water. They want to stay by the water and enjoy water to feel good. But of course, we have also severe health problems, mental health problems when we have the catastrophe and the disasters. Drinking water quality, of course, very crucial for us. Then we have waterborne and water-related diseases, and we have sanitation and hygienic problems, and we will hear more about this in the later presentations. I will actually not go into those specific health problems. I will speak more about water and the planetary health. And here I got this idea yesterday that maybe we can see the water system and hydrology as the blood circulation system, to speak your language, because water is actually transporting a lot of compounds, and all life is dependent on water, so it needs to have water, and it also takes away waste. So yeah, it could be a good metaphor for the water. And then actually the pump, the heart, would be the radiation, not only solar, and the gravity, and also then the capillary actions, because water can also go upstream sometimes, and up from the ground and up in the trees and so on. Well, the symptom of illness right now, if we want to stick to this planetary health metaphor, is that we have an intensified hydrological cycle with climate change. The warmer atmosphere can keep more moisture. We have an increased evaporation. So even though we have more precipitation in many parts, in many sites of the globe, we actually get drier conditions because we have so much more evaporation and evapotranspiration. Well, we see that we get more extremes, more energy in the system, gets more extremes. Risk for droughts, and in general, larger difference between the wet and the dry climate zones. But then, of course, being a geoscientist, this is the illness and the planetary boundaries and health for us as humans. The planet will continue and have a good life. We are only here less than a second of the lifetime of the planet as humans. But if we want to continue as humans, we should consider the changes. As Johan Rockström told us yesterday, we have a very narrow window where we can be healthy. Nowadays, there are a lot of these kind of attribution sites where we can actually see whether a hazard or a special extreme event, whether this was caused or attributed to climate change or if it was not. And we heard about this morning, so I will not say more about this, but I can just mention 2 cases from Sweden. We have the very hot summer in 2018, if you remember. This one in my institute we have actually attributed to climate change. So we wouldn't have had that hot summer in a normal climate. But then we also had this extreme flood and rainfall event in Gävle 2021, if some of you here Swedes remember. And this one we could not attribute to climate change. Precipitation is in general very difficult to attribute to climate change because it's so variable, also under natural conditions. Okay. At my institute, we do these web-based climate services, and I would just like to mention a few where you can find different indicators that might be interesting for your research if you work on climate and health. We have been part of setting up this Copernicus climate change service that is operated from the UK. But now they have moved to Bonn, actually, because of the Brexit. Sorry. Yeah. And we have another site called climateinformation.org, which we made for the WMO and the Green Climate Fund. It was mainly focused for developing countries where there is very sparse data conditions. And then we have a Swedish one that is called Klimatscenariotjänsten, where you can find different indicators for current situation, past situations, and in mid-century and end century. And then I would like to promote another new site, and it was supposed to be launched today, and I'm very sad to say that it did not, so it will stand another week. You have to wait another week for this klimatläget@smhi.se. And I'm a bit proud of this one because it's not, we are also a political organization, and we see what happens with our colleagues in the US currently. They are sacked, they cannot dispute their data, their projects are closed, they are not allowed to publish. But we are actually brave enough to come up with this site right now. And here we are more strongly telling the general public about the severity of the situation, because SMHI has not been so strongly into this. We have been a little bit afraid of being accused for being activist or so, but this time we really take a step forward to show what we can do and how severe the situation is. And here you can actually follow the development of the climate each day. And actually Johan Rockström showed this graph also, but without the colors. And I think this one is a good one. The dotted line is actually the prehistorical or the pre-industrial temperature during an average year. And then you can see every year from then, but we have colored them into the different decades. And you can see it's very clearly from the colors how the shift is actually going on. And you can also see very clearly here on the top lines here, the last years that Johan was talking about, that they are actually outliers, that we are moving much faster now. He spoke about this yesterday. So I think this is good to communicate in a more straightforward way to the general public. And we also have this is in Swedish, this kind of very straightforward messages around climate change, that this is a global crisis, that it's not going to disappear, it's going to last for hundreds of years, that we are not on the right track, that the greenhouse gases are still increasing, that all emissions actually matters, that everyone is affected by this, that we have more extreme and more strongly extreme weather phenomena, that the global sea level rise will continue for many hundreds of years, and that we have those tipping points and that we need to adapt, and also that we are going to pass different points of no return. We know this already. And also that we have this biological loss and we have this triple planetary crisis. So these messages are pretty strong, I think, from a governmental organization in those days. But under here, we also have more positive messages of what we actually can do, and we have a lot of facts. So we have also a lot of links to where you can actually find facts that why we are saying this. So anyway, understanding hydrology is, of course, super interesting for an hydrologist, but it needs to be linked to society. Because hydrology is not pristine anymore. We don't have any pristine rivers on Earth, I would say. Everything is affected. So we use water for energy. We have a lot of hydropower stations. These are like blood clots in the system. We have industry. We heard about the food industry before and processing, but of course we have a lot of other industries, and they are also releasing a lot of waste. They're using water, but they are also releasing wastewater, and their products are releasing or contaminating the water. We have agriculture. We already heard that 70% of the water abstractions are actually for agriculture on a global scale. I would say much less in Sweden because we don't have much irrigation in Sweden at the moment, but it will probably be increasing a lot in the future, especially in southern and southeastern Sweden. We have forestry that takes a lot of water for the trees. And then, of course, ecological diversity, resilience, recreation, etc. needs water. So there is a lot of trade-offs here. And another problem is this with system analysis, because all these sectors and all those users are actually planning and using water in their own ways without communicating. So we need to have another system here where we can actually plan and prioritize the water, what is going to use for, but also where to put the excess of water when we have a flooding situation. Then, I don't know how much time I have. Oh, 5 already. Ooh. Yeah, so I wanted to show you just a little bit about the past, because I like this with learning from the past. So, because we have changed hydrology a lot, as I mentioned. It's not pristine, it's all managed. And we can learn from what we have done so far. So 150 years ago, we actually suffered from hunger in Sweden. We were starving. And at this time, we started to drain our lakes. And we can see this very clearly in our observations, that we have lowered the lake levels, but also that we had now less storage in the lakes. So we had more peaky flow, more fluctuating flow after removing lake volumes. We had the industrialization starting by the beginning of last century. And actually a lot of our development was driven by export of forests. So we cut a lot of forests and we exported forests and also corn to the UK. But here we also had a law in 1909, but where we were actually forced to plant every tree that we took away. So clear cuts had to be replanted. And we started also to have more productive forests. They are not natural to a very large degree any longer. It's all planted. And this actually, did that we had, it resulted in a lot of evapotranspiration from the trees. And this is also something that we can see that affected the rainfall, maybe in Finland and in the Baltic Sea, but not here. But we can see that we had much more evapotranspiration from this. Of course, the major thing we have done is all the hydropower. We needed electricity So we started to electrify the country by building these hydropower dams. We have a lot of them in Sweden. We only have 4 rivers that are not affected by hydropower. And you can see here the regulation degree is enormous. And well, there are pros and cons with this. The thing is that we completely reversed the curve of flow regime. So now it used to be a high peak flow and then low flow during the winter, but now we returned it. We kept the peak flow in the dams, and then we released the water during the winter. So we completely reversed the whole flow system. Then we had the depression, and this was actually a way of getting people into labor, that we started to drain the arable land and also the forests. So this happened also during a long time. You can see this is an iconic picture here with the Kävlinge one, where we had 30% wetlands, but they were all drained, so only 3% remained after these exercises. And of course, we had much more productivity in the arable land after this, but we also removed a lot of the buffering capacity we had in the soils. So now we had more flushy systems even again. Then we had urbanization, and also we got sign of this with using chemicals. So during the 60s, people were more aware of, we heard this with Sverker Sörlin yesterday also, that people got aware of the pollution in the water. And already then we discussed this with reduced biodiversity, and we started to put calcium on our lakes because they were acid, and we started to introduce measures to remove eutrophication in the lakes and also in the Baltic Sea. And then came climate change, of course. This is also, actually we had, it all started, I would say, in 1985, because then we had our first dam break. We had one of our hydropower dams that broke, and then we realized that we have designed the dams for a very dry period, although it was a 30-year period, which should be a climate period, but it was a dry period. So we had to redesign all the dams, and that was a lot of work, but they were reconstructed in a good way. And so this was when we started with climate adaptation, I would say. And then we have seen more and more weather extremes, and I was very happy with the Sustainable Development Goals that we worked on. They released, was it 2015 or something? So, but as you know, now we don't really know if we are going to continue this work, or because in those days we worked a lot on sustainability, I think, in the whole global community, and UN was very successful. But this might not be the case anymore, and we are facing this triple planetary crisis. So, what can hydrologists do? Yes, we do those forecast and warning services. We do the attribution. We work with resilience to design different measures and evaluate their impact. We provide indicators of change, and we try to raise awareness in society. And this is actually from one of our global NGOs where I'm actually currently still the president. I've been so for 4 years, but I'm leaving now this summer, where we have made a community paper, and we arrange different scientific decades. And our current decade will be on science for solutions, where we will work with other disciplines, trying to come up with good solutions for adaptation, not only to climate change, but also to environmental change in general. Yes, so problems with water is too much, too little, too polluted. And my message here, I think, is that water is affected by many factors. Climate is only one, and climate is not always the main driver to environmental change or water change. So I'm a little bit optimistic with what I have shown. We have already affected the water systems a lot. So a little bit like Kevin Noon said, I mean, this is also a proof that we can manage it, and we can maybe also manage it again. But we also know that it can we can have a lot of side effects. So of course we need to be cautious when doing this. Thank you.
Thank you. Thank you. So, how many people here are opera lovers? Can I get a hand up? I love opera myself. We have a few opera lovers here. So maybe you have been to see Verdi's The Masked Ball, which is really about the Swedish king getting shot while he is on a masquerade. How do I tie this to the next speaker, you wonder? I will do it this way. We are now opposite one of the best urban parks in Europe, which is called the Haga Park, which is just opposite us. If you have time, take a little walk up down to the sea level. It's beautiful. And we are now going to talk about exactly that: urban forests, urban parks. How can they affect air quality? How can they also become psychological lungs for people living in big cities? And we have Jenny Klingberg with us from the University of Gothenburg. Welcome, Jenny.
Thank you so much. Yes, I come actually also from the Gothenburg Botanical Garden, one of the largest botanical gardens in Europe, and one of the most beautiful, if you ask me. There I do research in applied environmental science. Actually, I started from the air pollution perspective, but when you work in a botanical garden, you kind of end up working on vegetation. I also work part-time as a director of the Gothenburg Global Biodiversity Center that is hosted at the University of Gothenburg. So warm welcome also to come to Gothenburg and have a walk in the parks there. Okay, so the talk today will be about urban forest and benefits for human health and well-being. We had such many good talks in the previous session, also around urban areas and urbanizations. And humans affect these areas a lot. I mean, it's a lot of concrete, asphalt, impervious surfaces. And this is affecting the environment in many ways. For example, the radiation balance. So the urban areas is warmer than the surrounding rural landscape. We have an increased risk of temporary floods due to surface runoff when there are heavy rains. There's more pollution, traffic emissions and other sources of emissions. And when you have a green space, often it looks like this. It's a shortcut lawn, which is like a green desert. But we of course have to remember that there's also positive aspects about urbanification, that we are actually being more efficient in using infrastructure and public transport and so on. But what I really want to emphasize in my talk is the need for urban forests. And when I say urban forest, I mean everything from the peri-urban natural areas, forested areas, to city parks and city street trees. And the benefits that these trees and forests provide is numerous. For example, they regulate the local climate, they improve air quality, they decrease the risk for these temporary floodings, they reduce noise and prevent erosion. But we also have all these other aspects for education and inspiration and recreation and tourism. I mean, since so many people live in cities today, this is also a place where they have the need to have the opportunity to connect to nature and to actually get the relief, like the psychological lung that you were talking about. Of course, the green areas in the urban environment also provide habitats for biodiversity. So I'm not have time to talk about all these benefits. I will start with urban air quality, which, as you heard already, is a serious problem in many cities. And here in Sweden, we have much better air quality in many other places around the world. But still, recent estimations say that there is around 6,700 premature deaths per year in Sweden, and the health effects cost society several billions per year. And the negative effects also on vegetation and materials. So how does the vegetation then and the urban trees influence the air quality? Well, there are two important processes here. So air pollutants are deposited on the leaves and needles of the trees, thereby removing the pollutants from the air and improving air quality, both locally and on the city scale. But we have to remember that if we place large trees in a narrow street canyon where there are emissions, these trees will also reduce the dispersion and dilution of the air, and thereby decreasing the air quality locally. It will still improve the air quality on a city scale, but locally it can be worse. So therefore it's sometimes tricky to measure, even though it's been shown in many, many modeling studies that you have a positive effect of on air quality of urban trees. But we did a study a while ago where we wanted to really show how big is this effect on the air quality. So we measured NO2 at 2 locations at the same distance from a traffic route in Gothenburg. So the gray site, the gray bar, is an open site, while the black bar is a tree-covered site, but the same distance. And then we also included here in the graph an urban background site, the white bar. So the first 3 measurement periods are in winter, before leaf emergence, and the second 6 measurement period are during summer, when there are leaves on the trees. And we, as you can see, there is in all the measurement periods, there is lower concentration at the tree-covered site. But the difference is bigger during summer when the trees have leaves. Then it was 23% lower, while before leaf emergence it was 9% lower. So we can clearly see that there is a positive effect of vegetation on the air quality, but we need to remember that we cannot take away all the air pollutants no matter how much trees we plant in the cities. It cannot replace the importance of emission reductions. The next question is then, well, how much does the trees actually take up? How much is accumulated in the leaves? We wanted to measure the air pollutants both in the air and in the trees of the leaves. And we also wanted to see if there was a difference between different species. And here we did measurements in the Botanical Garden Arboretum, which is a perfect place for making a study like this. But because here we have plenty of tree species in a rather small area with similar environmental conditions and the same exposure to air pollutants. So a great way of using the botanical garden collections. But let's start with the question about comparing air and leaf concentrations. So in this study we focused on PAHs, polycyclic aromatic hydrocarbons, which is a large group of pollutants that is formed in incomplete combustion. We divided them into 3 groups. LPAH is low mass, so mostly gaseous. HPAH is particle bound, high mass. And then the MPH is in an intermediate group. And we can see that there is a relationship between the pH concentration in the air, which is on the x-axis, and on the leaves, which is on the y-axis. So this emphasizes that trees, the leaves, can be used for biomonitoring purposes, but it's also clear that there is no saturation, at least not at the pollution levels in Gothenburg, which are, of course, lower than in many other parts of the world. Then if we looked at the different tree species, so we had 11 different species, and here the yellow bars are broadleaf trees. The dark green is the conifers, and then the striped one is larch, which is a deciduous conifer. To the left, you see the results from the gaseous pHs. So here, if we try to generalize, the conifers are better, even though the spruce does not follow the pattern. But if we look at the particle-bound pHs, then the broadleaf trees are better at accumulating these compounds. And larch, that was really has the potential to improve the air very much. But I guess my point with this one is not that we should go out and plant a lot of larch trees all over our cities, is that there is a mix of pollutants in our cities. So therefore we also need a mix of trees. We need a diversity of trees to be able to remove the air pollutants. Okay, let's leave the air pollution for a little while and talk a little bit more about health, other types of health and well-being. So I was involved in a project a while ago called Valuation of Ecosystem Services Provided by Urban Greenery. And there we sent out a postal survey to residents in Gothenburg, asking them questions about a park that was very close to where they lived. And a very interesting result from this survey was that the parks that the residents perceived as more natural, that had a high naturalness, was also more appreciated. So there was more activities reported, it was reported higher aesthetic values, and also reported a higher perceived well-being when the residents spent time here. Regardless of naturalness, it was also clear that different groups in society use these green spaces differently. So, for example, women, they had more activities in their close-by green spaces. They also reported higher aesthetic values and higher perceived well-being compared to men. And also there was a difference between elderly people and younger. So this is something that is important to remember for planners, that different groups in society use these green spaces differently, and there need to be something for everyone. Something that was also very interesting in this study was that we didn't only send out the postal survey, we also did a lot of biodiversity inventories in these green spaces. And the perceived positive values of the urban green spaces were highest, where we also had the objectively measured biodiversity highest. So it was clear that the people, the residents here, actually appreciated the more biodiverse parks higher. So, how much greenery is needed? Well, on the right here you see a picture or a figure from a study that I took part in a few years ago, where we actually estimated the leaf area in the Gothenburg municipality. It's because the leaf area can be used as an indicator of many of these ecosystem services. But it is a little complicated to do this. And recently, an urban forester called Cecil Konenandijk, sorry for the pronunciation, he suggested a very communicative guideline called the 330-300 rule. So here, the 3 stands for that you should see 3 mature trees from every window in your home or at your workplace. you should have 30% tree canopy cover, not on a city scale, but on a neighborhood scale, also for it to be equal for the residents. And you should have maximum 300 meters from the nearest park or green space that is available. So, of course, Cecil here also recognizes that it's not always possible to have this focus on trees. In some places, there's other types of greenery that is more appropriate. But this is a guideline that is now used in many cities around the world, actually. They have adopted this. Okay, so should we just get out there and plant as many trees as we can?
Yes.
Well, then I have to say stop just for a little while. I think it's really, really important that we increase the greenery in cities, but in a sustainable and well thought through way. And sometimes that means that perhaps the best option is to preserve existing greenery, if it's possible. We also have to think about, especially in street environments and city centers, that we need trees that survive and thrive in this rather harsh urban environment. Not only now, but also in future climate, because these trees will have to stand there for hopefully 50 years and more. So it's really important not to just focus on the number of trees, but to think about which tree species to plant. So here I have some photos from an ongoing research project where the Botanical Garden is involved, where we have a lot of experiments. So we are drowning trees, and we are trying to kill them by drought and heat stress as well, just to see which trees can actually tolerate the future urban climate, and to be able to give guidelines on which trees to plant. So, focusing on solutions, we have more than half of the population in the world live in urban areas, and that is supposed to increase. In Sweden, we already heard it's over 85% of the population that lives in urban areas. And I would say that we definitely need urban forests to be able to have sustainable and healthy cities. And my main point is that it's important to select the appropriate tree for the right location and for the intended function in these sustainable and healthy cities. And here, botanical gardens, such as the Gothenburg Botanical Garden, has a key role, as I see it, with both the research regarding which species are suitable, all the collections we have, the scientific collections, which is a perfect way. I really invite you to do research on this and use these collections. But it's also a place, a location, where a green space in the urban environment, which is very important for recreation and mental health and well-being in the city. And actually the Botanical Garden was involved in the development of a green rehabilitation program for stress-related unhealthiness. So with that, I say thank you.
Thank you. Wonderful. I think we just all feel the calm by looking at all those trees, don't we? It's interesting. Maybe the botanical gardens will have like a renewed function as we're going to climate change. Okay, we will. Last but not least, we are going to look at the planetary health. So how do we connect the very, very global levels to the local levels when it comes to water, sanitation and hygiene? We have Sarah Dickin with us from Uppsala University. Welcome.
So good afternoon, everyone. My name is Sarah Dickin, and I am based at the Center for Health and Sustainability at Uppsala University. I'm a health geographer, and I teach a course on planetary health in the master's program at our center, as well as a module for medical professionals. So if you do have resources or materials you want to share, I'd be happy to receive those, as it's a fairly new program and in development. So today I want to talk about planetary health and links to water and sanitation. We've heard a lot about the climate crisis, but we also have a water crisis, a global water crisis, and unlike climate, there is no water COP to address these issues. So today I want to talk about some of the disconnections or gaps that I see between the more planetary level or scale that we've been talking a lot about and the more local scale where water, sanitation, and hygiene programs are being implemented. So I hope that this kind of discussion will give some food for thought. So first of all, how is the water health nexus addressed at this planetary level? So we've already seen, I think, in the last couple of days, a number of different examples or ways that the water cycle is being impacted under the Anthropocene or the Capitalocene, as some have suggested. We know that water is a finite resource, and here we can see another example of these types of impacts, which is water stress. And here we're looking at where water demand is exceeding the available water supply, so renewable surface and groundwater resources. And those areas are shown in darker red. We often get focused a lot on the available water quantity. We also need to think about water quality, particularly when it pertains to human health. And here you can see that globally, water bodies all over the world are contaminated with fecal coliforms. And there are also, of course, a couple hotspots shown in red, certain areas of the world, Southern Europe, South Asia. And of course, this has implications for human health, but actually this type of fecal contamination also has a lot of implications for ecosystems, for microbiota and aquatic ecosystems to think about as well. And then in terms of how people are able to use safe drinking water and sanitation, we can see that this is very uneven around the world. Human experiences of water insecurity. And in this map, you can see that there's a few areas that are shown in gray, and this is because the way that water access is tracked, and also this is at the household level. By the way, we have heard before about water access at farms, for example. That's not being tracked. This is water at the household level. And to meet the SDG target 6.1, you actually need to test for water quality in terms of chemical, biological contamination. Many countries are not yet able to do that. So that's why you see certain gray areas. But overall, 1 in 4 people lack access to safely managed drinking water, and 1 in 2 people still lack access to safely managed sanitation. So this is billions of people that we're talking about. So in terms of these global water challenges and the implications for health, first of all, I wanted to look at how this is being represented in the planetary health literature. This is just a very simple analysis from Web of Science, just to illustrate where we see these types of topics being included within the topic search for planetary health. You can do this analysis yourself, but you see certain topics being represented here. Dietary sustainability, for example. This one on climate health risks also includes a lot of work on heat, stress, and heat risks. And you probably see a number of the other topics that have been presented so far. What you don't really see are water-related health risks. So this is a topic not really that well represented in the planetary health literature. Looking at other planetary or large-scale initiatives, we have the Lancet Countdown. Many of you are familiar with, and this includes a series of indicators. These are just the indicators here on impacts. And you can see the indicators. They have to be included. They have to be well evidenced and also relevant at a global level. You can see, again, a number of indicators here on topics we've already discussed, like heat, on disasters. You don't see a lot of indicators related to waterborne disease that impacts low and middle income countries. So we can see that certain areas are being left out. And of course, this is related to data quality issues, but we also know that what gets measured gets managed, and certain topics kind of float to the surface. certain geographies end up being excluded with these kinds of approaches. Another type of global approach, the planetary boundaries or system boundaries. There's been recent work trying to apply a justice lens here. So looking at safe and just corridors, and the way that this is done in regards to water is by looking at the liters of water that are needed for basically daily survival, so 50 liters or 100 liters, and how does this link to the broader Earth system, planetary boundaries. What we see here is these numbers, liters of water. When we look at this from the WASH perspective, this doesn't really address the human right for water. So the human right for water includes a number of other aspects. It has to be biologically safe, chemically safe, culturally acceptable for people to use, and also affordable. So with this kind of reductionistic approach, you do miss some of these other aspects related to human rights, and sanitation also has a number of other related criteria. So what are we missing when we take this very broad perspective and we overlook certain localized challenges? One example I want to give is the case of schistosomiasis. This is a waterborne disease. So it's spread due to fecally contaminated lake water. So this is not water that people are consuming. It's lake water that people are exposed to through their livelihood activities, through children playing in water bodies. There are chronic symptoms that affect organ systems. It can cause bladder cancer, for example, over time. And it affects children and adults. And there's also a number of gendered impacts. So this disease is very sensitive to temperature changes. The snails are very sensitive to temperature. We can see that the ranges are changing. It's also sensitive to flooding events. So we've seen in Lake Victoria, where my own research is ongoing on this topic, that there's been recent extreme floods, and this creates new pools of water where people can be exposed to the infected snails. And this is not just a climate change issue, it's also an issue related to nutrient pollution. So nutrient pollution contributes to the growth of water hyacinth and other invasive species that can provide new snail habitats. So at the moment, this is kind of a neglected planetary health challenge because it's not really captured by these more planetary initiatives. And what does this mean for actually addressing the disease? At the moment, it's addressed through mass drug administration. So drugs provided to school children, which is a very effective way of treating the disease, but it doesn't really address those more systemic drivers, including environmental exposure pathways. And our research, speaking with lakeshore residents, this is in Lake Victoria in Kenya, we see that people are not really aware of the exposure pathways through which they have been exposed or been infected with the disease. And most people have not been part of any kind of community meeting or received information on those environmental linkages. So with the way that this disease is being addressed, not through a planetary health lens, we're missing opportunities to actually eliminate, as opposed to just continually treating with mass drug administration. So that is kind of looking from the more planetary scale. I also want to talk about how the water, sanitation, and hygiene sector itself has been dealing with climate and other types of environmental changes. So the sector itself kind of originates from public health engineering. The main focus has been on child health, diarrheal disease, and also connections to malnutrition. More recently, a bit of a focus more on the social outcomes as well. There really hasn't been any kind of environmental connection that's been made. This is despite the fact that the IPCC actually says that one of the most effective ways to reduce vulnerability is actually to provide these basic public health services, drinking water, sanitation. So we often get focused on these more technocratic solutions, but actually one of the most important interventions is actually these basic public services. But in recent years, in the WASH sector, there's been a little bit more attention to these climate issues because, of course, this is actually hindering progress to provide these services. So flooding damages water and sanitation infrastructure, and this can lead to wider environmental contamination, disease outbreaks like cholera, for example. Droughts and water scarcity, this can also impact infrastructure, but it also can increase water collection time, which is a gendered issue, particularly impacting women. There's also concentration of pollution as well as decrease in hygiene behaviors because you have less water available. Sea level rise is also an issue when combined with other types of land use changes. So we can see that in regions where water is being extracted for irrigation, for example, this allows saline intrusion to happen, and drinking water becomes contaminated with too much salt. And this has implications for particularly vulnerable groups, pregnant people, people with hypertension, and so on. And for many waterborne diseases, foodborne diseases like diarrheal diseases, these are really impacted by temperature conditions, warming temperature, as well as precipitation. So even more recently, the sector has become a little bit more aware that it's also part of the problem. There are a lot of methane emissions from poorly managed sanitation systems in urban areas. This is largely in low to middle income countries where we have pit latrine types of sanitation, so as opposed to water-based sewage systems. And this is most of the world that has these types of systems. These systems actually release a lot of methane. Wastewater itself, untreated wastewater releases a lot of methane emissions, and now there's more to think about in terms of methane. But there are also, of course, ecosystem impacts from all of this untreated wastewater, and you can see from this map that most regions of the world in white here have no wastewater treatment. The darker green color is where you see very high levels of wastewater treatment. So most wastewater is not being treated. It's being released into the environment with all of these potential impacts. Even in regions where we have wastewater systems in place, sewage overflow events linked to climate change are overwhelming those systems and still releasing sewage into the environment. So this is an opportunity also for win-win solutions, because we can work on providing sanitation systems that are both meeting the needs for human dignity, sanitation services, but also addressing some of these challenges in terms of reducing emissions and also addressing aquatic ecosystem quality. So in the sector, there is now more of a focus on trying to produce these systems in a way that's climate resilient. So there's a focus on trying to assess WASH infrastructure to see how well it can withstand certain types of threats. So assessing boreholes or water points, tube wells to see how well they can withstand certain impacts, as well as different types of approaches to flood-proof or make these types of water systems climate resilient. This is also partly coming from the climate finance world, where there has been this idea of additionality. So the climate finance will not fund providing basic sanitation services, but they will fund the cost to sort of upgrade that several steps up in the air to make it flood-proof. And this is a bit of an issue, of course, for the most vulnerable regions where you don't have sanitation services. So there's a big focus on the technology aspect, and I wanted to just provide one more example of the more social aspects of adaptive capacity. Because the WASH sector is really coming from the engineering side, there's been a bit of a gap in terms of looking at other aspects, the more social aspects of adaptive capacity, and also how we can transform these systems. Some of you may be aware of these domains of adaptive capacity. There's been a lot of research looking at these in other sectors. And I wanted to provide an example of how these could be applied to the WASH sector. So this is a case study looking at adaptive capacity in southwestern Bangladesh, together with a WASH NGO that works with implementation. We wanted to look at how those 6 domains of adaptive capacity could be adapted to a WASH context, and also how that related to perceptions of being able to adapt to climate impacts on WASH systems. So first of all, in terms of the climate impacts that people report experiencing on their drinking water, their sanitation systems, we can see that there are a range of impacts in terms of drinking water becoming less accessible, harder to get to, also certain quality issues to a certain extent. We also see certain impacts on sanitation systems, that these are being damaged and require more repair and more investments. But most respondents actually say they do believe they could deal with the climate impacts on those services. And we also see that more women report this than men respondents, which just highlights the fact that you need to think about who you're asking these types of questions to, who is actually managing these issues. When we look at these different adaptation domains and try to link them to WASH, we see a number of interesting findings. And one of the findings here is that it's not just about actual assets, for example, and using a wealth index, it's about who is actually controlling those assets in a household. So looking at some of these power issues. We also see the role of social norms And being more flexible around social and gender norms can actually lead to better ability to adapt to climate change in a WASH context. There are a lot of gender norms in WASH. For example, can women get involved with fixing a broken water point or not? We also see the importance of decision-making issues within a household. So if you are going to invest to upgrade your water services, or perhaps get a few different water options, build a rainwater harvesting system to store water, to be more flexible, who is actually making those types of decisions in a household? This is something that's important to think about, and here we can see it's actually linked to perceptions of ability to adapt. So these results show the importance of thinking about the social processes of adaptation and not just about the more technological solutions. So just to conclude, first of all, we can see that Earth system disruptions are widely impacting the water health nexus. They're exacerbating efforts to meet the WASH targets, which are SDG 6.1 and 2. We need to think about how to integrate these more localized water and sanitation issues into the more broader planetary health work and Earth system science. We need to, when we use a planetary lens and look at this very broad perspective, we need to be very careful about what kind of localized risks are being neglected with these types of approaches, particularly those affecting the most marginalized communities. So this requires better, more comprehensive tracking, even in cases where we don't have the best data quality, to ensure that we're promoting planetary health justice. And then finally, for the WASH sector, and this is probably a lesson for other sectors as well, we need to think about not just the technical solutions, but also how we can navigate these social processes of adaptation. This includes things like agency, power relations, social norms, and justice concerns. So we need to not just replicate technocratic solutions that haven't really worked in the past. We need to think about how to address those underlying planetary health injustices. So before I end, I just want to mention that I am starting a critical planetary health working group. If this is of interest to you, it's going to be based at the Uppsala University Conflicting Objectives Research Nexus, Unicorn, and there will also be some information on the new Sustainable Health in Partnership website. So thank you very much.